Good morning, good afternoon, and good evening. Welcome to the 422nd continuous Zoom session of Ifph. Today, our topic of discussion is homeopathic management of old age. And our chief guest is Dr. Hubert, MSc, DHMS. Before we proceed, let us have a silent prayer for a moment. Thank you. Well, the geriatric population or the populations above the age of 65, that is the latest age bar, is considered as the geriatric cases and is increasing. Definitely, they are always symptomatic. Sensations, different thoughts, so many physiological or physical symptoms are there, and they cannot tolerate the heavy dose of metals and medicines. That the poisonous medicines given by the allopathic schools, they cannot tolerate because their vital organs are very weak. So the only scope is the easy administration, easy palatable medicine, the medicine, the gift of God, the homeopathy. So on behalf of Ifph, I am once again welcome Dr. Hubert. You can have the presentation for the next 45 minutes. Then we have a discussion. It's over to you, Dr. Hubert.
Thank you very much, Dr. Manoj. This is a good day. I am very happy to be a guest here. Not I am a guest, I am in this house, always in this house. Ladies and gentlemen, dear brothers and sisters and friends. Can you hear me? No.
Okay.
I want to say about what Dr. Manoj said, that the geriatric problems. A few years back, no, not a few years back, it was when while I was studying for the medicine third year. One day, my old friend, I heard that his grandfather was dead. So I went for the funeral. That time, there was a great people were assembled there, a crowd, very huge crowd, because he was 85 years. 85 years, and he's a teacher. He's a healthy teacher. He's doing his work, and all the time he used to get up in the early morning, 3 o'clock, and he go for the job, and he taught many students. So he was an important person in that area. So many people were assembled. That time he was late. Some of them. Then one of his uncle, my friend's uncle, came to me and asked, "Are you a medical student?" Yes, I told you that I am a medical student. I have a doubt. My father is living. That person who was dead in the morning, he says that there is a doubt that he is living now. Flight movements are there. So he told me that it had happened in his years back, that he was laid down like this day, like 3 days in such a condition. And today itself, in the morning, he was doing some electrical work. And that time he was shocked, electrocuted. And that time he was unconscious, and that time a nice hospital here. They sent them to the hospital, and the doctor declared that he's an important doctor in this place, an MBBS doctor. He told that he is dead. They sent to his home, and after 5 minutes, he again jumped from the bed and asked for water. This time, he wanted me to check that body, whether he is living or dying. That I was very much astonished, because I was studying that time only. I have some little knowledge about that. That time no forensic medicine. That time it is called as jurisprudence. I just, with my little knowledge, I checked his pulse and everything, heartbeat and everything with my hand and with my ears. And at that time, I remember that I have to check that light test. So I asked them that time, all the people are gazing to me, staring to me. What I am, if I say that he's living, that time everything will. If I said that he's dead, if I don't know whether he will again jump over from the lay down position. That was my problem. Anything, I am in a dilemma. I could not say anything. That time, what I was thinking, what to do. Then at last I said that he is dead. In my opinion, he is dead. If you have any doubt, you go and ask somebody whether he's that next day I got the smell of his body was burning. That time I I have some relief. That is what I want to say today. This is many of the doctors, so many people then calling me for to declare death. So we have to know that what is death. Before going to death, we have to know that what are the conditions are happening in a person in before the 1 week before or 40 days before, or we have to check whether he then we can prophesy. Sometimes we can prophesy that he's going to death. This is what they are asking. But many times they will ask what will happen, what is the position of doctor, where will he live for sometimes. Sometimes one day one called me and I went and checked that a dead body, he is living. He lived after 1 week, 1 month after that incident. So if I declare that he is dead, as people said, what is the reason? What will be the consequences? Then death. We know that everybody, we were in the mother's womb for 9 months. We don't know, we cannot remember it. We were all in our mother's womb for 9 months and lived there, and we don't know what happened, how they cared us before that. Eh? But this is the thing, the death is coming and awaits we all. The definition of death is the permanent, irreversible cessation of all biological functions that sustain a living organism. Brain death is sometimes used as a legal definition of death. The remains of a previously living organism normally begin to decompose shortly after death. We know that there are two types of death: clinical death and molecular death, somatic death or molecular death. This is the cessation of our functions of the brain, functions of the heart, functions of the lungs. We may call it as a somatic death. It is happen after 7 minutes or some hours. The molecular death will happen. Then only said that the death will be completed after this time. That time only we will declare that the person is dead. Before that, there is chances for a revival. There is a chance for a revival. So we have to be very careful before declaring a death. What are the things we know? We should understand that what are the conditions of death and what is before that, what is happening in a person in an older age. There are some diseases. There may be some diseases. Some people may be very healthy and sudden death may occur. With this condition, there may be coma, syncope, and asphyxia. These are the three conditions. Coma means the function of the brain is stopped. Then syncope means the heart stopped its functioning, and asphyxia is the complete asphyxia is the cessation of the functioning of the lungs. So in most of the cases, we can see that heart diseases are the main prominent thing. Most of the death is caused by heart diseases or heart attacks. The second comes cancer. The third comes chronic obstructive pulmonary diseases, that is the functioning of the lungs and dyspnea or COPD, or it is called as the COPD. Then cerebrovascular death, diseases, that is stroke. Stroke means there are so many reasons we can be. Then Alzheimer's disease. Alzheimer's disease, most of the people, we know that now most of the people, so many old people are suffering with some sort or at least some sort or little or more memory loss, and they do not know what to do, and it is very struggling. Most of the people are struggling very much in such conditions. And the another part is diabetes. Another cause is diabetes. And next, the complications of lungs diseases, pneumonia, influenza, and accidents. These are the main causes of death. Then come to, I told you that somatic death. Somatic death is the first condition of the cessation. It is called as, it says that somatic death is characterized by the discontinuance of cardiac activity and respiration, and eventually leads to the death of all body cells from lack of oxygen, although for approximately 6 minutes after somatic death. Somatic death after 6 minutes, somatic death after 6 minutes, it may start. Period referred to as clinical death. A person whose vital organs have been damaged, maybe. Then we come to a man. Okay. No sharing. Why?
Yes, you are the co-host.
Yeah, that is, I can see show something in my computer. So this is not functioning.
Yes, you can have Doctor. You are the co-host. I think you can.
Camera is not, rear part is not. No, just, yeah. Can you see it? Please make it bigger.
No.
Nothing can be seen. Nothing can be seen, huh?
Only in a small screen.
Yeah, how to make it big? Because the screen must be
In the slideshow mode or other screen share, maybe.
Yeah, this is my computer. It is in a big for the big photograph is big, but
Yes,
now only
Abel, or who is the host there? Abel, are you there?
Zoom. Now?
No, Doctor.
Smaller. Some photos are there.
Yes, photos are there, but put it in the screen sharing mode, I think.
Sell that. Can you see it?
No.
Very smaller.
Abel, are you there? Who is the host today? Dr. Baburaj?
Not, I am not sharing, but I can only show through the.
Yes, if you can, you please share the screen, Doctor. Otherwise, it is not.
Because otherwise, the mic is not okay. That time, mic will not be much better.
Then,
so okay, then these are the conditions. Let me say. Okay. So I can take. I can see.
Okay.
How to tell that is near. One person is, what are the symptoms? What are the signs we can see?
Yes.
Decreasing appetite may be a sign that death is near. Decreasing of appetite. Appetite is lessened. Sleeping more time they are sleeping. Third one, becoming less social. they will reduce the interaction with the other people, they will cut short. The other one is changing vital signs. Changing vital signs. Then changing toilet habits, constipation and other conditions they may. Weakening of the muscles. Every muscles may be weakened. And dropping of body temperature. Experiencing confusion. These are the most important symptoms and signs symptoms seen in this condition. Now, other condition, this is perhaps the most cultural aware sign of impending passing, drowsiness and fatigue. Drowsy feeling, always drowsy. Discolored skin, color may be changed. We may say that someone may, the old age, we can see that they are very nice, but in that time, the oxygenation is reducing, then change of the whole body color may be changed. Mental confusion. I told you earlier that mental confusion. They don't know whether they have hallucinations and everything. We know that anacardium is a medicine. Anacardium is a medicine for use. I have a patient I am treating for last 2 years. He had an accident and he lost blood from too much blood lost and confusion of mind, and always he cannot walk. That time he was bedridden. I had given him medicine and now he just walked. He could walk just with the help of other helping things. He can walk. Now he told me that always he is having great fear. He has fear all the time, confusion, and all the time suspicion. And I gave some medicine, anacardium. That time, whenever I gave anacardium, twice I had given, that both of the time his skin complaints are more aggravated. But his fear of anxiety and where there is a fear of fall is reduced. Now he don't have that much of fear. This is one of the conditions what I want to say. And there is the interrelation between the skin and mind. Labored breath. Labored breath is another noticeable point. Labored breath means they want power to take breath. It may be if they have any lung conditions, they may have difficulty in breath. But it is a generalized breath. All the time they may feel that they have to take extra effort to take breath. So that is one. The another reason is kidney failure. We know that kidney failure, the conditions of after the diabetic or toxemia, blood toxemias and everything may cause, and the cleaning process will not be regular, and kidney may be weakened and weakened. If we have two kidneys, if the one is damaged, the other will work, compensate the function of the other one. Otherwise, if both kidneys are affected or have any problem, that is complete. We have to, in such conditions, the removal in many homeopathic medicine will help. In such conditions, we can reduce the creatinine level, and these are the things we can do in. The other condition is cold extremities. Cold extremities. We know in carbovage conditions, lactosis condition, that time the body temperature will be reduced, and the extremities may get cooled. Perspiration may be more, and the total body temperature will be less. These are the conditions. So then heart. Heart. You can see heart. Now can you see it? Okay. Heart. Once Louis Pasteur said, founder of microbiology, says that little science takes you away from God, but more if it takes you to Him. That is the condition. If one is going, we know that there is most people are in the old age. They have confusion and fear of death and gloomy and always curses. But some exceptions are there, like our Ismail Setsa, Mammootty. They are old age, 70 years old age. They are old people. We say that in age, we can say that they are old, but in heart, they are very young. Mammootty, can we imagine that Mammootty, the best veteran actor, is an old man? We cannot say that he is an old man. Can we say that Mohanlal is an old man? We cannot say that he is an old man because they are very energetic. Why they are energetic? They are living like a child. That is the secret of it. They are living like a child. The mind is like a child. They are always doing their work. Then they are jumping from one attitude to another. Their mental change is always from children to big old people. They are always changing their mind for to act. In such conditions, they have to prepare for to make their mind very young. So we have to give medicines. These are the conditions what I told you that these are the conditions we can see in an old age. Old age people, they are very much fixed. Most of the people are very much fixed. We know that Tuja mind is a fixed mind. They cannot change their mind. They have their own way of thinking. So we have to, according to the situations, we have to change our mind. Otherwise, we cannot live. That is why they called that old generation. Why they are called old generation? Because they are not changing. But if they are changing, we know that in our platform, whenever our Sir, Ismail Sir comes in this platform, that time many people are joining. Why? We know that a person, he is an experienced person. He is telling the truth. He will not bluff. That is the belief of such a person. That type of growth we can see in people. That internal person is always now we can say signs 40 days before death. 40 days. 40 days, what are the change? Why do change happen at the end of life? Why do changes happen at the end of life? When someone is dying, the body slows down and shows signs that the person is approaching the end of their life. Losing weight, feeling weak and sleeping more, feeling hot or cold. Why? Heat and cold. We know that on medicine, which one? Mercurius. Human barometer. We call it as human barometer. Why? Both conditions it may show. It is a syphilitic medicine. It is a damaging medicine. Syphilitic means that it may damage, cells damage, destructions are happening. In such a condition, Mercurius is very much effective. Whenever we give, there is decaying conditions of the jaws and lesser parts. There are very soft parts will be damaged, and in that conditions we can give Mercurius. And Silesia, there is assimilation of the nutrition. The body is not collecting the food from the gut, intestines, and there is the slowing down. Every metabolism is slowing down. That time we can give Silesia, but we have to check whether there is any conditions of any lung conditions. In serious lung conditions, we should not give. But in some conditions, if 200 can be used, but the lower potencies should not be used. Another thing, we can see that approaching the end of their life, losing weight. Losing weight. Why? Losing weight. One of the reason is great fear and anxiety. Great fear and anxiety about the coming days. Some people may be very much prepared for their death. Some people will not be prepared for their death. They think that they will be always in this world. So they are thinking about the worldly things. But if they think that there is another life, another nice life, if we live in this world, a nice life, we will live with the God, and such persons are always very stable, and they are godly people are always stable, but the atheists don't have such a satisfactory life. Now, losing of weight. I told you that losing of weight. One is the mental sphere. Then the other is the bodily problems, the diseases of like diabetes and exhausting diseases, damaging self-damage happening. In such conditions, we can use Nexomica. Nexomica is a good medicine for night watching and sleeplessness. And these conditions, we can use Nexomica. And there is flavorants and hallucinations. Some people have hallucinations. They say that some illusions. They say that somebodies are coming to me and trying to kill me, and I am seeing such people. Nobody can be seen that they have hallucinations. We call it as hallucinations. In that condition, hallucination, we can use Hyoscyamus, Stramonium, Gelsemium. These are the medicines most commonly using hallucinations. For belladonna itself is a good medicine for it. Hallucinations, and aconite predicts the day of the death. Aconite, it is an acute medicine. Aconite can be used in higher potencies in such conditions. Then we can reduce the fear. And in addition to that, we have to give some, I don't say that advice, because if they are old people, I already told that they are very much concise and very much fixed in their mind, and they know. Some people may know how to live. They are always looking the positive part of the life. We could show that the positive part of the life, as well as the positive things. We always allow them to do something. Don't allow them to sit idle. Don't allow them to do all the time the constant mind, the stagnant mind. We should not allow. If now it is very much helpful that mobiles are coming in this time. Most of the old people are always with the mobiles, and their mind is energetic. Now they know that they have to see everything in the world, and they can update their mind. So that is one of the change. In such conditions, I told you that Nexomica will help a lot. Then selenium, Nexomica, Carbo vegetabilis, China. In old age, China is an important medicine to help. I told you that blood clots and heart complaints. In such conditions, heart complaints, blocks, and stroke. In such conditions, Calcarea cactus and Calcarea carb and Calcarea floor. These are the three medicines we can use in such conditions. It will very much helpful. I had many experiences with the stroke people. Many people were, and we can see that if these symptoms are coming in a younger age, that means that he is living an old man's life. These are the symptoms can be seen in a young people. I know one person. He was a student in my church. He was always sitting. Wherever the time comes, all are standing. That time he will sit. All the time he is sitting like an old man. He became a very old man now. Every hair lost. If he looks like he's a young boy, but he looks now 70 years old man, like a 70 years old man. So we have to change it. We have to change our living lifestyle. Then the losing of weight, feeling weak and sleeping more. I told you why they are feeling weak and sleeping more, inertia, that is sedentary habits. Wanted to live, we know that we have to struggle. We have to fight against the thing. Then only we can live a good life. Then feeling hot or cold, eating and drinking less. Eating and drinking less. We know that some tonics are there. Tonic medicines, cratages, alfalfa, ginseng. These are the medicines used in old age people. And we can give all salts. 5-phos means the phosphate tissue remedies we can use and to reduce that thing. Eating and bladder and bowel problems. This is a very important condition. Bladder and bowel problems. Constipation. Constipation, habitual constipation, the bowel movements are very less because the peristaltic movement is less. And in sugar condition, the water absorbed from the intestine, large amount of water will absorb from the large intestine and it may produce very tough constipation. In diabetic patients, as well as in many patients, if they have diabetes, the most thing is constipation. Constipation, we have to how to reduce constipation. One person, one lady, beautiful lady, my friend's wife, she had an accident and she lost her vertebra. She cannot walk, very difficult to walk. And she came to my hospital, and with each and every step, she's with painful condition. She came and he asked me, "Doctor, tell me one medicine. Please help me to pass my stool because I have to take it mechanically from my rectum all the time." What I said is that you have to practice drink 4 glasses of water at once in the morning. Immediately you have to take 4 glasses of water. That condition is okay. That mechanically removal is okay. She had normal. This is a normal tip, I can say. 4 glasses of water at once take in the morning with help to outcome conditions of constipation. And Nexomica, medicine opium, and alumina are the medicines. In addition to that, we can give Calimore 6X will help. Then bladder problem. Just think what I said, that 4 glasses of water, drink 4 glasses of water. This can be practiced in all the people, all those who are hearing me. This because if we have 6 liters of water, if we drink 4 glasses of water means the all quantity of the blood will jump to 6 to 8. Immediately it will absorb to the bloodstream and the water level jump from 6 to 8. That time the blood will be concentration of the blood will be reduced. It may go easily through all the blood vessels. This is the water therapy, the theory of water therapy used in Japanese. 4 glasses of water, drink at once. Then the blood, if the blood vessels are narrowed, and it may wash. If we can drink lukewarm water, that is good. Thank you very much. Then the other thing is breathlessness. Breathlessness is the important point. Breathlessness, most of the people are suffering from breathlessness in the younger age or in the middle age, or in the old age. One of the best medicine is we know that the medicine which is used for COVID, that is Arsenicum album. Arsenicum album is the number one medicine. Then the other one, if there is phlegm and it is difficult to pass sputum from the lungs, we cannot take it from the lungs. In such conditions, we can use Antimtot. Antimtot 200 use. You can use Antimtot 3x in certain condition. It will help a lot to expel all the sputum. I have many times I had faith in such conditions. They have very thick sputum. It is not coming out. That time, one of my friends told me that you give arsenic Antimtot 3x. It helped a lot. Then another medicine is important medicine is used in bronchial asthma and all asthmatic bronchitis and tuberculosis, and in all conditions, that is Basilinum. Basilinum is the number one medicine, I would say, that arsenic album and Basilinum. Basilinum, but you use it with care, don't give more, very minute doses. You can put in a bottle, one pill, 1 arm in a bottle, and a 1 gram or 2 gram bottle, and mix with water and give 1 or 2, 3 drops. Now it can use like 50 millisecond scale. It can give for to control asthmatic conditions. We can control any medicine. I think that this is a number one medicine for to control asthmatic conditions. Then other in not much serious that condition, we can use tuberculum onum. I don't use lower potencies. I use only onum more than onum. Onum is enough. Then another medicines, Arsenicum album and Imcock taught. I told you that Ipecac and Arsenic album at a time we can use, but that is my theory. You know that some of the people will not accept my views, but Antimtot and Arsenic album at a time we can use. It may help a lot. Because what is the reason we are using Ipecac? Ipecac is an anti-peristaltic movement or that type of changes. It can have a tendency to expel the things from the body. So mucus can be expelled from the lungs. Next medicine is Bryonia. Bryonia is a commonly used medicine. Bryonia, Baptist Bryonia, Drosera is another medicine we can use. Drosera, but it is it can use Drosera. Stramonium is another medicine we can use in. I think that many people will not use Stramonium, but Stramonium is a very good medicine for in breathing difficulties. Justitia is another medicine in difficulty in breathing. Justitia, and these are the medicines, commonly used medicines for to manage the cases in then next condition is noisy breathing. Breathlessness, I told. The noisy breathing. They are taking great labored breath and long breath, and number of breath is reducing, decreasing. We know that number of how many times we breathe in a minute, but the minute will be reduced to some extent. Noisy breathing. That is because there is any blockage in that area in the windpipe, that time they will take the labored breath, and the narrowing of the windpipe that may cause wheezing more, and wheezing another things, rolls and rails, wheezing. We can through auscultation we can see the breathing is difficulty. In such conditions, we can use, these are the medicines we can normally use. And I am not very much interested in using rare medicines. That is why I am always use polycrust. If any, in such conditions, bladder, I never use bladder. But in some conditions, I use bladder, but I don't get much relief. But I feel that we have to immediately give a relief for the patient. If the medicine is not affecting, if the medicine, one medicine, if my method of treating is, if the medicine is not acting within 10 minutes, I will not use that medicine at all. I will throw it away. I never use that medicine. I want 10 minutes. Within 10 minutes, they should get a relief. Otherwise, why we are using that medicine? That potency is maybe a thing. Potency may be a wrong. It may be my fault. But what I want to say is, these are the conditions that I am trying to conclude. You all heard my talk. Now we have a discussion part. Please. Yes. Thank you very much. Thank you very much, all.
Okay, Dr. Hubert, you forced the listeners to think about themselves and what is seeing around. We are all marching towards that point, what you have said. That's a very important. The same way, very shocking also too. Yes, those who are interested to participate in discussion can go to the participant list and please raise your hands. Then there are a lot of medicines with the bowel problems. I think aloes is the number one medicine that the patient cannot the stool passing involuntarily often, or there's a great urge before reaching the toilet will pass. It's often seen in old age persons also. Aloes is the number one medicine there. Some of the prostate problems often disturbing the old age persons. They have to hurry for urination.
Yeah.
Many times disturbing them.
I forgot to say that.
It's an important thing. When the short number of the persons, they're very there are some also rage. Immediately they'll respond in a violent manner. Often all the persons, they don't have the tendency to wait. The patience is lost. You know that in case of the Vitalaka, where the patient, they said that patient loses all the person delicacies or decencies. Vitalaka. So there's an indication there. So many medicines are there. Then another medicine, I think, is Lacanus or some medicine, where Ken says as very cold patient feels just like a dead body. He covering with so many clothes. This is, I don't remember the exact word. Can you make material? Feels like a dead body, covered like a dead body. Yes, cover this. The word is just covered like a dead body. I'm not, the medicine starting in L. I think Lacanus or some medicine will be there. Okay. So those who are like to participate, who can add. Definitely there will be a lot of persons who experienced what fellows are there. Yes, Dr. Geriatric just now. She was there. We are not participating for the last couple of days. What happened in Germany and what happened to you?
Okay, hello everybody. Hello, Dr. Hubert. Thank you very much for your very nice presentation, impressing presentation. Hello, Dr. Manoj. Always a pleasure to see you. It's a very interesting topic to treat people with age. And I would like to share you, I had a very good experience with my own mother, who became 92 years old. And she was, until the last 3 months, she was totally without any chemicals in all her life. She was very good. And was very special. She did not like medical doctors. She did not want to go there. We do that on a natural way. The only person she did accept was myself. So in the last phase, she developed weakness of her heart, very natural, and she got swollen legs and a bit difficulty to breathe in a special kind of dry cough, like this. And I had a very, very good reaction on ammonium carbonicum.
Ammonium carbonicum, yeah.
You know ammonium carbonicum, C30 every day. She was having this, and she was quite good until the end.
Okay. Which potency you used?
A C30 every day.
Every day, 3 times, huh? Or
Once a day. When I came in the morning, I said to her, Mama, here are your homeopathic remedy. And she said, I always like to take this.
Is it in pills? Is it in pills or in tablet form or in water form?
No, very small globules, very small.
Yeah, that is why she is like, because life, there is a saying that life begins at 80.
Yeah, and there was also a nice story, let's say, about, I did see the process was going down, of course. And let's say 1 week before her death, she still could move a bit and like this, and she had that cough and a bit of, she already had water in the lungs, down in the down part of the lungs. Yes. Yeah. I was with auscultation, and she never would have gone to a hospital. So that was the situation. So I said to myself, Beatrix, what are you going to do now? And I decided to give her 1 dose of lycopodium. It was worse on the right side. Okay. And my mother had been a very good teacher. She was a bit that personality also. And something very interesting happened. It was 1 lycopodium C30. When I came back in the evening to give her a bit of meal, to make everything ready for her, she said to me, listen, the last weeks I've been feeling so terrible. I'm much better today. Beatrix, it was not so nice how I was feeling, but today, this night, I'm feeling fresh, free. She did not have to cough. Very special reaction on lycopodium, but it was for 1 or 2 days, and she got weak again. And at the end, very interesting, she had a death which she had been wanting all the time, a quick death. She had a kind of apoplexia, fell to sleep, and after 1 day, she passed away to the other side. So that was a very special experience. So I give it to your heart. Ammonium carbonicum with old people is a good challenge.
Thank you very much, madam. Thank you very much.
Okay.
I want to say one thing. I saw 3 generation death. That is the only person I had, because I saw my grandfather's death. It is 45 years, 50 years back. Next, my father's death. Next, my son's death. These 3 deaths I saw with my hand, with my eyes. It all happened in 45 years gap.
Yes.
But these 3 deaths I have seen. That is my experience.
Okay.
Okay, thank you.
Yes. Okay, doctor, for nice summation, nice description. Now it's Dr. Anand Jaiswal, our regular participant. Dr. Anand Jaiswal, please unmute yourself. Participate, please. Dr. Anand Jaiswal, yes.
Good evening, sir.
Good evening.
May I audible?
Yes,
yeah, you are audible, but I cannot see your face. But I know your face.
Okay. This session is very. May I audible?
Yeah, you are audible. Yes,
it's a wonderful session, sir.
Thank you very much.
This session is very neat. I think I I thought some months ago is some type of geriatric session will be. That's the regarding sleeplessness in old age. Can you
Yeah.
suggest some?
Nexomic and Hyoscyamus. Both, I use both medicine at a time, but it will help a lot. But some other medicines are saying, but I am not. I am using it with, and it may get good results. One potency.
Okay.
Sir, potential dose, sir. It's dose, sir, weekly,
1,000, yeah.
monthly.
No, daily.
Hey.
Daily, but
Repetition, sir.
yeah, very small doses.
Okay.
Very small doses we can do at night. We can use 3 times daily is also okay. No problem.
Okay, sir.
Okay, yes.
Sir.
Right. Now, Mahmoud Zaidan from Jordan, yes, please. You can expect
Yes.
a long question. Yes, come on.
Yes, do you hear me?
Yeah, I can hear.
Yeah, I have a question and a comment. The
If-
comment
yeah.
is concerning the constipation in old ages. It might be due to gastric acid, HCl suppression.
Yeah.
In this case, it will result in a constipation. As a result of age, there will be HCl production deficiency. If we can replace the HCl in the stomach by pills or any other mean, we might alleviate the constipation. This is a comment. This is a comment.
Yeah. Thank you, sir.
Thank you. The question is, what do you say? What do you comment about the toxicity of arsenicum album? And some agencies claim that it is a toxic and never use it. What do you say about that?
Yeah, they don't know what is the arsenic album medicine. That is the first number one problem. The second one, they are claiming this is saying that to make the homeopathy to expel from the society. That is the next reason. But the original reason, I can say that we know that it is all we are using 1 drop of arsenic album and 100 or 50, 500 or 50 millismoles. We are using a very we are using whenever we use. In my theory, whenever these succussions are doing, that time the vehicle is changing in the third thing. Altogether, whenever we shake with both are agitating each other. We know the medicinal part and as well as the smallest quantity of the medicinal component, and the vehicle is always agitating each other, and the third thing is forming. That is, we call nanoparticles are forming.
Did we reach to the nano? Did we reach to the nano site?
Pardon?
Did we reach to the nano size?
Yeah. I saw some. I got some literature from the site and I read it.
One book is there by Dr. Rajendran. Yes, Dr. Hubert. One book by Dr. Rajendran was there in Macho. He presented on this. Then another Dr. Enrique Meneses from, I think from the Cuba. He's now in settled at Switzerland. She also participated in the Ifph platform and described this very nicely. What happens after giving the medicines, the changes in the DNA produces so many protein molecules which are in favor of curing disease. Then another person from the Calcutta is also a lot of experiments are there going on, but we don't know what happened. That's the problem. Then again, as Dr. Hubert said, this deliberately done. But what happened? They never followed the Hahnemann's advice. You repeat the experiments, but they never repeat. That is the problem. If you have any doubt, then you can repeat the experiments. You can prove it. Okay, you can accept or reject, but that's not doing it. But another thing is that they are at the same time they are giving arsenic dioxide 1 milligram per ml. We are giving 1 by 100 raised to 30 part of a grain in the 30th potency. 30 is 0, 0, 0, 0. How much is that? Nobody can count. So which one is toxic? The 1 ml per 1 milligram per ml or 1 by 10 raised to 30 part of a grain. Which one is toxic? From a common sense.
If they are sleeping, we can awaken. If they are pretend to sleep, nobody can do anything. This is a proverb says in Malayalam that ഉറങ്ങുന്നവന് വിളിച്ചുണർത്താം, ഉറക്കം നടിക്കുന്നവനെ വിളിച്ചുണർത്താനേ പറ്റുകയില്ല. That is the reason. They are pretending to sleep.
Yes. Okay. Now, anyone who want to participate in this discussion, can another 3 or 4 minutes remaining and have. Otherwise, we can again go to Dr. Beatrix about the COVID situations in Germany.
About the situation in Germany at the moment?
The COVID.
Yeah.
Yes, yeah.
Well, at the moment, I don't know how it's at your place in India. We are getting more in the winter time. That's also why I could not share very often at the moment, because I have a lot of patients. And Corona is getting more active again in our country.
Yes.
Yeah.
That is
Yeah.
true.
And
That
you
is
know,
true.
the problem
Here also
is that all the people who have been vaccinated, it's about 60 million in our country. About 60%, 70% are, or more than 70% have been vaccinated. They feel very safe, very secure, can have their lives and get infected, get symptoms and infect others.
Yeah.
Also being vaccinated. So we have a big mixture, and but I think we will cope with that. My patients are more or less well, and yeah.
Yes, we can
How is it
definitely.
in your country at the moment? You are coming to the spring, to summertime, or also to winter time?
Yes, to spring, all season. But what happens here is that it is decreasing in India and increasing in Kerala. It is again around 11% Kerala. Around 93 to 94% persons vaccinated. And the prevalence is 11 to 12%. So what is the number? What any can confirm that it's a failure. Well, this will create a chronic carrier state. As we just studied the typhoid baby, the typhoid condition. There was a person, chronic carrier was there. She caused the disease to many other persons without having some symptoms on her body. Just like that situation, I think. Now, Dr. Muhammad say that once again, raise the hand. What is the question? Yes. Please unmute yourself.
Yeah, hello?
Yes, please.
I would like to ask about the involvement of the mitochondria according to due to metabolic acidosis in the event of death. It might stop walking and stop production of ATPs. That's why we lose energy, and the body will lose the energy to operate the other body organs. What do you comment on that, Dr. Hubert?
I don't know. I have no comment. I don't know.
This is basic.
Yeah. It is in fact the duty of not a physician, but the physiologist is the duty. They have the biochemist duty. They have to answer it. We are not concerned about that. Okay. Now it's time to wind up the session, and I think we can. Dr. Beatrix once again, please say the vote of thanks to our Hubert.
Thank you. It's always a pleasure to me to be with you, to be with my colleagues from India, And I send you many, many greetings from Europe, from Germany. And I'm so happy that you are practicing with such great access homeopathy. And I really like to hear your experiences. And Dr. Hubert, thank you very, very much. It was very striking, your stories, what happened to you. But this is what is keeping in our mind if we hear these stories and what happened with our patients. So stay well, stay happy with homeopathy, and stay healthy, and all the best for all of you. Thank you.
Thank you. Thank you.
Yes. Well, that was the end of the 422nd day of Zoom session, English session, or English edition. I have to go to the Malayalam session. So those who are interested to participate in Malayalam discussion can also stay there. Others can leave. It's over to you, Dr. Tanesh, for the Malayalam session. Thank you.
Okay. Bye-bye.
Bye.
Bye-bye.
Good evening, all. Though I was very late in joining this session, I was hearing all those sessions from the very beginning. Dr. Hubert has done a wonderful job here by presenting one of the best from Dr. Hubert. It is a very nice presentation by all means. I must say, by all means, because you have covered almost all thing about these old age problems, and it was really a very, very good session. I must say that you have presented this condition, but there is a question from Mohammed Zudain, and I would like to answer to that question. But what are the medicine? I would like to add one more medicine here, because everybody, I used to use opium as one of the best remedy for the sleeplessness during this condition. Opium really works in old age, and that's one of the point I would like to add here. Though Naxomica is a very good one, but at the same time, these hyoscyamus also works. But the best remedy for that particular condition is opium, because as you know that these
Thank you,
opium works in the sleeplessness. There are two conditions, either in sleeplessness as well as in sleepiness. Both conditions opium works. Whenever you see an old patient, most of the time the patient may be in a sleepy mood, and so one of the best remedy for that condition is opium. And then you can think of nuts, mosquito also in that condition. So this is the point I would like to add to the presentation. Anyway,
Thank you.
I'm very happy to congratulate Dr. Hubert for the same. And so thank you all for joining this session. And I think Dr. Mohammed Zaidan has a very good dinner with this answer too. Thank you for your question, and that's the reason why I was able to answer in such a way. Thank you all for joining session. So you may wait for the session. I think you can also take a session tomorrow. Are you there to present a session tomorrow, Dr. Mohammed Zaidan? Can you present a paper tomorrow from any of the subjects you would like to present? If you are ready, then we can give a session to you tomorrow. We will definitely come out addition with your presentation, so that you can, even if it is a presentation for 20 to 30 minutes, it doesn't matter. Followed by Dr. Manoj, Dr. Hubert, and myself will be giving addition to your presentation, so that it will become an international presentation tomorrow.
No, I am not a homeopath, but I am interested to listen to you. Actually, I am a bachelor of medical analysis and postgraduate diploma in nutrition and food sciences, and I have practicing microbiology in Jordan, and I have interest in oxidative medicine.
Okay, you can present a paper on microbiology or something like that.
No, I did not publish. I did not publish a paper, even though. But I have a scientific thirst and a scientific eagerness That's why I'm joining the homeopathic
Oh.
presentations, because I like it.
Okay, then that's no problem. Then Dr. Anand Jaswal can present a paper if you are ready. Then we will. Then now I would like to ask the same question to Dr. Manoj, because Dr. Manoj is always here, but I know that tomorrow he is having a lot of work to complete, and so I am not compelling Dr. Manoj, but he is adding a some and substance to every presentation. That is one of the most important thing. He's adding more. Today also he had come up with a lot of medicine. Yesterday also he has come up with a lot of medicine. So that's the beauty of the presentation, and he has handling such thing in a beautiful way with more and more medicines for the particular disease or what is particular problem. So we will have a session tomorrow with some other person. Thank you all for joining this English session. Once again, thank you, Dr. Hubert and Dr. Manoj, for this beautiful presentation tonight. Namaskaram. IFBHന്റെ 422ാമത് ദിനമായ ഈ ദിനം നമ്മൾ വീണ്ടും നമ്മുടെ കോവിഡ് പ്രതിരോധ മരുന്ന് വിതരണത്തിന് യഥാർത്ഥത്തിൽ അങ്ങനെയാണ് സുപ്രീം കോടതി പറഞ്ഞിരിക്കുന്നത്. നമുക്ക് കോവിഡ് പ്രതിരോധ മരുന്ന് കൊടുക്കാനുള്ള അവകാശമുണ്ട് എന്ന് തന്നെയാണ്, അങ്ങനെ തന്നെയാണ് CCH പറഞ്ഞിരിക്കുന്നത്. പിന്നെ നാം അതിനെ ഇമ്മ്യൂണോ ബൂസ്റ്റർ എന്നൊക്കെ പറഞ്ഞ് താലോലിക്കേണ്ട പ്രത്യേക കാര്യങ്ങളൊന്നുമില്ല. എന്നിരുന്നാലും അതാണ് ഇന്നത്തെ വിഷയം. ആ വിഷയത്തിലോട്ട് പോകുന്നതിന് മുമ്പായി എനിക്ക് തോന്നുന്നു ഇനി ഇപ്പോഴൊരു സൈലന്റ് പ്രയറിന്റെ ആവശ്യമുണ്ടോ? എന്തായാലും ഒരു മിനിറ്റ് നേരം അങ്ങനെ ആവട്ടെ, ഒരു മൗന പ്രാർത്ഥന.